So I'm audible. Can you see me?
Yes, ma'am.
Yeah. Okay, great. So let's begin today's session. Keep the back and neck straight. Sit comfortably on your mat. And when you feel ready, gently close your eyes. Start observing your breath. The natural flow of your breathing as you are inhaling and as you are exhaling. Just keep observing the flow of the breath. Keep the body aligned and comfortable. And slowly begin to deepen your breath. We'll be chanting Om followed by the Shanti mantra. Inhale deeply for Om. Sarve bhavantu sukhinah. Sarve santu niramanam. Sarve bhadrani pasyantu ma kaschit dukhabhavati. Ma kaschit dukhabhavati. Inhale for Om. Om. Shanti. 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 Join the palms together in front of the chest and rub the palms together. Keep them on your eyes. Very slowly while blinking and looking at the palms of your eyes. Start coming back to the smile. and namaste. Let us begin today's session. So yesterday, we had completed Nadi Shodhana. We had done the final practice, right? The one that has been mentioned in Hatha Yoga text, the original practice. And today we are going to go ahead and do another pre-practice only for pranayam. But again, like Nadi Shodhana, this one is also known as a pranayam, even though it is a pre-practice, right? Kapalbhati. Kapalbhati. Yeah, Kapalbhati. Right. So in modern terms, once again, this is a pranayam and not anything else. But originally, this is a practice of Shat Karma. So six cleansing practices are called the Shat Karma. Shat Karma, SHATKARMA, Shat Karma. So if you go and look at the traditional texts of Hatha Yoga, you will find that Kapalbhati is one of the six cleansing practices, right? Just a second. Yeah. So it is one of the six cleansing practices that we have, right? And in Hatha Yoga Pradipika, when you see Kapalbhati, we'll see that Kapalbhati is like first Nadi Shodhana has been mentioned, and then the six cleansing practices have been mentioned. And like I said before also, Shat Karma practices, at least in Hatha Yoga Pradipika, they are only recommended if your Vata, Pitta and Kapha are not balanced. So if your three doshas are balanced, then you don't have to practice Shat Karma. But if they are not balanced, then the practices of Shat Karma have been given. And the last practice is Kapalbhati. So let's look at the term itself. Another name for Kapalbhati is Kapal Shodhana. KAPALSHODHANA. So Kapal Shodhana. This is another name that is given to Kapalbhati, right? And when you look at the term itself, so Kapal means forehead. Forehead, you will also find the term cranium, right? This area of the like body, the forehead, right? Bhati means light, knowledge, splendor. Like these are various meanings of the term bhati, right? So from the name itself, now you can gather the meaning. It is a practice which cleanses because it's a cleansing practice. So it cleanses the forehead region, which helps you to tap that knowledge that you are unable to tap because this area is not cleansed. Right? Shodhana means again. So when you look at the term Kapal Shodhana, Shodhana means to purify. Right? So when we look at Kapal Shodhana, so it is cleaning the forehead region, right? So this entire practice, when you do this practice, when you regulate your breath, you will see that the cleansing is actually like taking place in this region of the body, right? Now that you understand the meaning like of the term itself and the purpose of the term. So in modern terms, this is a pranayam, right? But if you go to any traditional text, it is not a pranayam practice. So it is done as a purification practice to prepare you for pranayam. Actually, Nadi Shodhana is a preparatory practice done to purify, right? And Kapalbhati, when you do Kapalbhati, all the excess mucus, it finds a way to escape the system, right? So it basically cleanses all the mucus that is there. It leads to the cleansing of the lungs as well. So it prepares you for the pranayam practices, right? So let's look at the other specifics. So Kapalbhati is always done in sitting position. So the Kapalbhati we are going to learn is generally done in sitting position only. So there are different types of Kapalbhati also. So the one that we are going to do, it is done in sitting posture and it is used to again cleanse the body, right? To prepare it for pranayam. So sitting posture, the posture is sitting. Then next thing is the repetition. It's a rigorous practice. Okay, so it's very like easy to feel discomfort in Kapalbhati. So to begin with, you can just do 10 rounds in fact. Right? And you can take this practice as you advance up to 50 or 100, even 100 repetitions. Right? 50 to 100 repetitions. It can be taken up till there, but very slow progress you have to make. Do not go against your body because it is in Kapalbhati. What we do is we are reversing the process. So when we are generally breathing in our day-to-day life, you will see that we are taking active inhalation and exhalation is just taking place. So exhalation is passive, but inhalation is active. When we do Kapalbhati, we reverse the process. So now the exhalation is active and inhalation is passive. So inhalation takes place because we are expelling the air out with so much force that the vacuum is created, and that vacuum, immediately pulls in the air, right? So because you are reversing the entire process of breathing, like you are reversing the active portion, making it passive, and passive portion, you're making it active. So a lot of people feel dizzy very easily, or they get some time getting used to this practice, right? So do not ever jump to directly 50 rounds or go directly to 50 rounds. You can start anywhere between 10 to 15 rounds, go up till 20 rounds as well. That's also all right. But do not go for 50 breaths in one, right? So let us look at some of the things you have to take care of before you do Kapalbhati. So first thing is Kapalbhati, because it exerts a lot of pressure on your abdomen, you have to make sure that you are empty stomach, right? So either you can do it early in the morning once again, or you have to give a gap of 3 to 4 hours, right, before you practice Kapalbhati, because like after a meal, because it exerts a lot of pressure on your abdominal region. Right now, when we will practice, you will see. Okay. Another thing which happens generally with Kapalbhati is that it because exhalation is passive, active. Um, it basically removes sleepiness, right? So if you do Kapalbhati before sleeping, you probably won't be able to fall asleep, right? So if right now you are having night time in your area, do not practice it, okay? Because you won't be able to sleep. So it removes that thing. It removes sleepiness. So it is one of the benefits also, but then it is a precaution also that you have to take, that do not practice it before sleeping. Like some practices, like yesterday we did Nadi Shodhana, right? So Anulom Vilom Nadi Shodhana, these can be practiced before sleeping. In fact, they will help you to calm down the mind and before going into sleep, right? Which is very good because generally when we hit the bed, our thoughts start racing and we sleep with that state of mind. So relaxation, comes later on, right? But if you practice Nadi Shodhana or if you do abdominal breathing when you are going to sleep, like just before that, you will see that you're able to fall asleep easily, and the sleep quality has also increased. But for Kapalbhati, no, you cannot do Kapalbhati before going to bed. Okay, so take care of this. Uh, Next thing is the benefits. So when it comes to the benefits, Kapalbhati has a lot of benefits, right? Like I said, you are reversing the process of the inhalation and exhalation, right? So exhalation is becoming active. The first thing is when we do Kapalbhati, right now I will demonstrate to you as well. So when we do Kapalbhati, you will see that you are engaging your abdomen, right? So the abdomen is being actively engaged in order to aid the process of exhalation. Okay. So first thing which can be easily noticed when you do Kapalbhati, all of these muscles, they are getting some activity. So it leads to the toning of the abdominal muscle, right? Then another thing, all the organs in the abdominal region, they are stimulated because you are applying pressure over here when you exhale out the air. So the all the organs in your abdominal region, they are once again stimulated. So all the like um, organs that are present, like your digestion, it becomes better, right? So stimulation is given to the liver, the pancreas, everything that is present over here. Basically, everything is getting stimulation, right? So all the disorders that are connected to your abdominal region, they are somewhere getting aid, right? When you do the practice of Kapalbhati, your nervous system is severely, like, severe is not the word, it is highly impacted when you do Kapalbhati, right? So when you complete Kapalbhati, you will experience this thing that you are completely, like, relaxed, one thing. And second thing, there are a few moments of silence that you experience in the mind after doing Kapalbhati. So it is a great practice to do even before your meditation, right? So if you do Kapalbhati and then sit for meditation, again, it is going to help you, support you, aid you. When you do the exhalation, right? So again, as I said, it is a cleansing practice. So the forehead region, there is cleansing that is taking place over there. All the excess mucus is expelled out from the body. And it is a great practice for people who have respiratory disorders because it also cleanses the lungs, right? When we come to the mental benefits, once again, as I told you, you are reversing the process. So it leads to a lot of relaxation. Like once you complete Kapalbhati, it also leads to a lot of clarity, right? And it helps you to concentrate the mind. Like if you sit normally for meditation and if you do Kapalbhati and sit for meditation, you're going to observe a difference between both of them, right? Uh, if you look at the other benefits, like spiritual benefits, if we see, so Kapalbhati, again, it's preparing you for the practice of pranayam. So it is, cleaning the, leading to the cleansing of the nadis as well, right? So because it is a cleansing practice. It also helps in cleansing the nadis when we look at from a spiritual point of view, which again prepares you for pranayama, right? And Kapalbhati overall is a really good practice, right? So keeping Kapalbhati as a part of your routine, you will already see there are a lot of changes that you begin to experience when you do it continuously at length, right? For a long period of time, right? So let's come to the contraindications. Then I will ask you if you have any doubts. Okay. So when we come to contraindications, uh, heart patients. First thing is heart patients. So heart patients uh, should avoid this practice. Do not introduce it to them. Second thing, anybody who has high BP, again, not a good practice for them, right? And if you guys are undergoing any of these conditions, so right now we are just having an introductory class. So you can see, like, just to experience, you can practice it, but overall avoid, right? If you have any of these conditions. In case of stroke, in case of vertigo, once again, it causes that dizziness. Like I said, initial practitioner might face some amount of discomfort or dizziness. So vertigo patients also should not go for this practice. Then in the case of hernia, in the case of ulcers, any abdomen related surgery, this is not, they should not go for this practice. During pregnancy, Kapalbhati should not be practiced. Right, during menstruation, again, Kapalbhati should not be practiced. In fact, wait for a few days, even after your menstruation, like 1 or 2 days, and then begin with intense practices which have a lot of which add a lot of pressure on the abdomen, especially when it comes to your menstrual cycle. Like, do not go for practices which are going to exert too much pressure on your abdomen. Even after 1 or 2 days of completing your cycle, right? So, are there any doubts related to this practice, or else I will begin to demonstrate?
Is
No.
Kapalbhati a pre-pranayam
Yes.
cleansing?
Yes, it is a pre-practice to pranayama.
So is it pre-practice is called Shatkarma?
No. Shatkarma are the 6 cleansing practices that are given if your Vata, Pitta, and Kapha, 3 doshas are not balanced, right?
Is that the Shatkarma which you can only learn from the like face-to-face class? Or
You have Jalneti in your syllabus. So Jalneti, if you would have learned in your like pre-recorded videos, they would have taught you the practice of Jalneti.
pre-recorded
Some
is
of
it
them
in
can
the
be,
online learning?
yeah.
Right,
So
I didn't look
see,
at it.
some practices can be learned. You can learn them remotely, like Jalneti you can do, right? Your eye cleansing practice, those you can do, but in your syllabus only Jalneti is there. But some practices like Kunjal, Prakshalan, these should be done under the guidance of a yoga teacher.
So these cleansing will only be done when the one of the Vata, Pitta, Kapha one is imbalance.
As per Hatha Pradipika, yes. If you look at some other Hatha text, like I mentioned, 𝐴𝐴 Samhita, so in that, no, the text begins with Shatkarma, so they have not said anything about this. But in Hatha Pradipika specifically, this has been said. That if
So,
Tridosha is imbalanced, then we look for practice of Shatkarma.
okay, it's quite difficult to find out whether the three doshas in balance, isn't it? So what will be the best way to check, easy way?
This you can ask in Ayurveda class, because that is where you cover the 3 doshas, no?
Okay.
Yeah.
Okay then.
Okay, so any other doubts from anyone?
No, ma'am.
Okay, so let me demonstrate this practice to you, right? Um, So you can just look at my abdomen, right? Mostly it's the role of the abdomen. So you have to take care of one or two things. So when you do Kapalbhati, your lower back has to be straight because the intensity can you guys see or hear me?
We can hear you, but looks like the video is stuck.
Yeah, exactly. That is what when I'm seeing. Okay. So Kapalbhati, few things you have to take care of. Lower back. Lower back always has to remain straight because you are going to apply a lot of pressure on the abdomen. So some people face lower back pain after the practice of Kapalbhati, which is only because they did not keep their lower back straight. Okay. So you have to make sure that the lower back is straight. Okay. If you can normally sit and make sure that the lower back remain straight, that is amazing. And if not, then you can do this thing. You can place both your hands, palms facing downwards on your knees, right? And shift the body weight forward a little bit. So if normally I am sitting like this is my posture, this is my back. Now I'm going to place my palm and lean forward, right? This is going to keep the lower back straight. Okay, so if you feel, if you're not confident, then go for this thing. Okay, so you put pressure on your knees with the palms and come a little bit forward, making sure that the back remains straight. Okay, second thing, second mistake that people make in Kapalbhati is they, the shoulders move and the face doesn't remain relaxed. Okay, so there is a lot of stress on the face as if they are making that effort to exhale out the air. There is no role of the shoulders or your, you consciously exhaling out through the nostril. Your abdomen is pushing out the air, right? And if you just remain relaxed, you will see that the air escapes itself. You don't have to put any pressure when it comes to your face region, right? So face and shoulders should be relaxed and the body should not move. So generally what happens is when we practice Kapalbhati, because we are applying so much pressure, like in the abdomen, right? So what happens is the body begins to move. So you have to make sure that the body remains stable. Another thing that is a common error is when you begin Kapalbhati, you go at a very fast pace, and by the end of it, your pace like totally wavers, right, and fades away. So suppose in the beginning I am exhaling very quickly, but by the end, because I get tired, the exhalation is not that fast, right? So to make sure each and every stroke from the beginning till the end has the same intensity and takes equal amount of time, right? So when you do Kapalbhati, there is another thing. So sometimes, we do it so fast that because we see other people do it very fast, okay? So we do not contract the abdomen to its full capacity because now we want to do that practice fast. So for beginners, it is really good to keep the strokes slow. Okay, so don't go for a very fast practice of Kapalbhati. Keep the strokes slow. So I will demonstrate both slow and fast to you so that you see the difference, right? But main focus is abdomen should be contracted properly, right? In a lot of Hatha texts, it has been mentioned that you should squeeze in the abdomen in such a manner so that your aim is to make the all the muscles over here, like all the organs, touch the spine, right? That is how much you have to contract the abdomen. So go for slow pace and consistent uniformity in your entire practice rather than going for fast pace and having like that fast pace established in the beginning and fade out by the end. That is not fair. Okay. So I like to instruct and in fact, even for my own practice, take 2 breaths before I go into the practice of Kapalbhati So that is how I will demonstrate as well. So placing the palms down, right? Shifting your body weight forward, eyes are closed, taking a deep inhalation, exhaling completely, inhaling and exhaling. And with the next exhalation, I will begin my practice. So inhale. For the last stroke, all the air is expelled. So forceful uh, exhalation takes place. So completely exhale all the breath in the last stroke. And then do not force your breath, allow your body to breathe. So if you feel that you don't want to breathe after the practice, that is also completely fine, right? So you can just allow your breath to return back to its normal place, or however your body wants to take in the air, allow it to do that. But last stroke should be forceful. So forceful exhalation is there. So, right? So earlier I was in, right? But now I'm exhaling out completely. So full exhalation, right? If done at a faster pace, so something like it will seem something like this. Okay. So I would suggest that you go for a slow pace for today and see if you feel that you are capable, right, of doing it fast, then go ahead and do the fast one, right? Once again, keeping the lower back straight. The expression all the time, it is going to remain the way it is. Okay. So you can go for fast or slow, but again, this is your standard of checking. If you're not able to contract the abdomen properly, then no need to go for fast. It won't give you any benefit, right? So first build your foundation, first find your rhythm and frequency, and then go for more faster practice basically. Then go for faster practice. Okay. So any doubt in this? Did you understand how you have to do it? Last breath is always going to be long exhalation. Okay. If there are no doubts, then yeah.
After exhalation, do we have to breathe in and then do our practice?
Okay. So last one you are asking when last we exhale completely.
Mm-hmm.
So at that point of time, like just bring your body back to normal posture, right? If you are choosing to tilt forward, right? And then just see if the body wants to breathe. So at that point of time, you're not going to make any conscious effort to breathe, but you will see your body, if it needs the air, it is going to inhale by like on its own. You won't have to like worry about it.
Okay.
So just follow your body.
Okay. So it means no deep inhalation, right? It is already
Yeah.
our body will take it.
Basically, you are just observing the practice after it is completed, but it is totally up to you. If you feel that you want to breathe, like immediately take the breath in, your body is feeling that need, then do it. And if you feel, sometimes people do not feel like taking breath after Kapalbhati, that is also okay, but don't do this thing that you are not taking the breaths because sometimes it doesn't happen, and then you are forcing the body as your body says.
Okay.
Okay, so if there are no doubts, I think we can begin the practice, right? So all of you come on your mat. We are going to do a little bit abdominal breathing, right? And then we will do yogic deep breathing, and then we will practice Kapalbhati. Okay. So keep your back and neck straight. Sit comfortably on your mat. And gently close your eyes. Keep the mind focused on the breathing. Make sure that your body is aligned. Slowly begin to deepen the breathing. Slow, long, and deep inhalations. Slow, long, and deep exhalations. Gently place the right hand on your abdomen. Exhale completely. And as you begin to inhale, feel your abdomen rise. And when you exhale, feel the abdomen contract. Continue the breathing pattern for a few more breaths. Slow, long, and deep breaths. Complete 3 more breaths of abdominal breathing, and then you can suspend the practice. Keep the back and neck straight and just observe your natural breathing. Make sure your back and neck is straight. We are going to begin with yogic deep breathing. If you feel the need, you can place one hand on the abdomen, one hand on your chest, or you can just sit straight and stay connected to your body to feel the rise in your abdomen and chest. Exhale completely and begin to inhale. As you inhale, feel the abdomen rise and then the chest rise. Expand the chest completely. Slight rise in the collarbones as well. And as you exhale, you will see the collarbones go down, the chest go in, and squeeze the abdomen to expel out all the air from the body. And continue working on your breath like this for a few more breaths. Go for 3 more breaths and then suspend your practice. Keep the back and neck straight and just observe the natural flow of the breathing. See how it has changed with the practice of abdominal and yogic deep breathing. Prepare yourselves for the practice of Kapalbhati. So keep your lower back, make sure that the lower back is straight. Keep the back straight, but specific attention on lower back. If you feel you need to place your palms on the knees, you can choose to do so. Come into the correct position. We're going to go for 2 breaths before we begin the practice. So first 2 breaths we are going to take normally, and then after the 3rd inhalation, you are going to begin the practice with the exhalation, forceful exhalation. So just follow my instruction. Inhale deeply. Exhale. Inhale. Exhale. Inhale. And begin your practice. 20 repetitions only. But if you feel uncomfortable before that, suspend your practice. Go for 20 strokes. On your last stroke, exhale completely. And return back to the normal posture, keeping the eyes closed and just seeing if your body feels like going for the breathing. You can breathe accordingly. If you feel that you don't want to breathe right now, it's okay. You can go ahead and do that. Just listen to your body. Going to practice one more round. Back neck straight. Again, if you feel the need, change the posture and shift your body weight forward. Or else just sit up straight. Again, going to go for 3 breaths. Inhale. Exhale. Inhale. Exhale. Inhale. And begin your practice with the exhalation. Going for 20 strokes. Making sure that each and every stroke is of equal intensity. And on your last stroke, exhale completely. Keep the back neck straight. Close the eyes, keeping the eyes closed. Just focus either on your abdominal region or your forehead region. Feeling the impacts of Kapalbhati. Slowly join the palms together. Rub the palms together. Place them on your eyes. Allow your eyes to absorb this heat. One more time. Rub the palms together, generating heat. Place them on the eyes. Very slowly while blinking and looking at the palms. Come back, open up your eyes. Start coming back. Did you face any issue or did you feel it was too much? Any discomfort, any doubts, anything you want to share? Please feel free to unmute yourselves and discuss that.
I didn't felt any discomfort. You know, when you're doing Kapalbhati, the way you place the hand, what do you say for that? You know, to
Sorry,
keep the back straight.
when you, which one are you talking about? This position?
Yeah. What do you call that?
No. It's just a way of keeping the lower back straight.
So whenever you're for the whole practice, you need to keep it like that, isn't it?
Yes. If initially you are struggling with keeping the lower back straight, this will ensure that the lower back remains straight.
Okay. And when we're doing Kapalbhati, so if go in your own pace or just start slow and then increase it, or for one, like if I'm doing like 20 times, can I keep all in the same level or do I need to keep increasing the speed?
No, that is what I was saying. It has to be uniform throughout your practice. So if you think that you can go for fast strokes and you can maintain that, then you can go ahead and do that. Only two conditions. One thing, you have to maintain it. Second thing, your abdomen should be contracted to its full capacity, because when you start doing something fast, you do not do it as well, right? So once you establish yourself in that thing where you are sure that your abdomen is being contracted properly, then you can go for fast. But if you feel you are already like at that advanced level, then you can begin with the fast strokes also.
Okay, thank you. And one more thing, like, you know, whenever we are like opening and closing, we are rubbing our palms and putting that in the eyes. What is the reason for that?
See, when you rub the palms, like you generate heat between both the hands, right? And eyes, you know, when eyes are closed, they should never be directly exposed to light. So immediately don't open your eyes, or you shouldn't. If you do, you shouldn't, right? So this, when we rub the palms together, like that heat, you know, prepares the eyes so that they can be exposed to the light again, right? That is
Okay,
why.
thank you.
Any other doubts from anyone? Okay, great. So continue your practice, and as I said in previous class also, abdominal breathing throughout this month you have to practice before sleeping and after waking up. And if you are already doing 5 minutes, now you can work on increasing that time, because now it has been a while since your class started. I think around 1 week has passed, right? More than a week has passed, in fact. So now you guys can, even if you feel that you have been doing it constantly, then you can increase that time to 10 or 15 minutes also, before sleeping and after waking up. Both these things. So continue abdominal breathing no matter what. Okay. Throughout these days when you are doing pranayama. All right. So if there are no doubts, I'll just close the session.
Sorry, what did you say? You can do it with after waking up and before going to sleep?
Yeah, abdominal breathing, yes.
Abdominal breathing. Okay.
Yeah. I was talking about abdominal breathing. Kapalbhati,
Okay.
never do it before going to bed. You will lose your sleep.
Ma'am, can we do the abdominal breathing while we are lying down?
Yeah.
Okay. Thank you.
Okay.
So Kapalbhati is good for lungs and for nervous system, isn't it?
Yes, it is.
So it's mainly
Digestive,
for lungs
respiratory.
and for the organs.
Yes, even digestive system, the digestive fire increases when you do Kapalbhati.
Okay, okay.
So I'll just close the session with Om Shanti then. Om Shanti to everyone. Enjoy your 3 hours and then join your meditation class. I will see you tomorrow for philosophy. Take care and bye-bye.
Bye,
Om
thank you.
Bye-bye.
Hello. Hello.
Yeah.
What
Hello?
time is the asana classes? Like the classes where you do the yoga posture. What time is that?
It's 2 to 3 p.m. Indian Standard Time and 6 to 7 p.m. Indian Standard Time.
Okay, all right. I'll check the time difference in Australia. 2 to 3 and 6 to 7. Okay, thank you very much. Thank you very much. Namaste.
Namaste.